It's very nice to see you in Istanbul. And about the mammoplasty, what kind of implants do you use?
I use silicone implants, silicone-based implants, and there are two shapes of implants: the anatomic implants and the round implants. It differs the patient's breast anatomy. The most important variation, choosing the correct shape, is not only the patient demands. Also, the anatomic structure of the breast tissue. It is more important than the patient's willings. Okay, sometimes I can have some arguments to my patients because we have to respect body, the shape of body. We have to respect. So if the breast shape is like more curved, more dropped, we have to choose anatomic implants to make a harmony with implant and the breast tissue. So I make my decision during the consultation.
I see. And what kind of brand do you use of implants?
I use two kinds of brands, the Polytech and the Mentor. There are some manufactural problems to having these brands in all around the world because of maybe pandemic, I don't know. We cannot reach all size of implants in Polytech, so now I use Mentor, but both of them are equal. The prices, the quality, the feelings, everything are equal in the both of brands.
And will patient require to change the implant after the surgery in maybe 10, 20, 30 years, or it will stay a long while?
If there will no problem, we never change the implant. We never recommend to change implant. But each year, the patients have to go to imaging, magnetic resonance imaging, to check the implant's surface. If there is no problem, I don't recommend.
I see. And can the patient do the breastfeeding after the implants?
Of course they can do it. Of course, definitely.
Does it matter if the implant is placed under the muscles?
No. This is the important point. In some patients, we have conversation. They think that the under muscle plane is more safety for the breastfeeding or anything. It's not true. The important point on the choosing the correct plane is we have to have enough breast tissue to cover the implant. If there is not, we must use the muscle. We must use the under muscle plane. But if the patients have enough breast tissue, we should put the implant over muscle. We should do it.
Why? It is better for the patient? What kind of difference for the patient?
The muscle is not belongs to breast tissue. The muscle belongs to chest wall. It is not breast tissue. It is belongs to chest wall. So using the muscle is not anatomic plan. We use it because we have to. Because if there is not enough breast tissue, we have to use it. But if there is enough breast tissue, there is not necessary to use it. Also, on the other hand, if the patient has enough breast tissue and we use the muscle, we put the implant under the muscle. By time, the muscle and the implant will stand together, but the breast tissue will go down. We call it waterfall deformity. So it is not good appearance after a while. So if we don't need the muscle, we will not use it.
I see. And is this recovery period painful for the patient? How it will happen when the patient recovers?
for pain, for recover.
Yeah, for pain after the surgery, first of all.
There are a lot of variations to pain level. The most important is surgery time, and if the surgeon respects the tissues during the surgery, the pain dies down. Okay, and also the pain level of the patient is important. The operation time is important, and the small variations. If you use the muscle, the patient has a little bit more pain. In my private practice, I don't see any difference choosing the plan. The most variation in my practice, patient. For instance, I do breast augmentation, and when I go to visit after surgery my patient, in some patients I cannot find her in her room. She goes outside.
Yeah.
But some cases,
Yeah.
I go and I see that my patients, she is crying of pain. It really depends on the patient to patient. But in the breast surgery, first 4 days are terrible. First 4 days, and then they heal immediately.
I see. And do you do some kind of procedures to relieve this pain? I mean, the first 4
Of
days?
course, we give painkillers, and these are enough for the first week. Also, I tell you before, I try to respect the soft tissues to having less pain, and also I work faster to finish surgery because of the Celal Alioglu. It also affects the surgery, so the pain level with this goes always down.
I understand. And the recovery period for breast augmentation surgery, so what is this? When the patient can go back to the normal life, and the final result when we can expect?
It is almost same rhinoplasty. First week, after first week, they can go back their normal life. But there are some limitations, up to 1 month. After 1 month, they are free to do everything, but they will see final result at the end of the 6 months or 1 year later. But the breast tissue are not a hard tissue. So by 1 year, 2 years, 3 years, 5 years, it also changes. So there is no final result actually on breast surgery. But at the end of the 6 months, they can see the final result.
I understand. Thank you very much, Dr. Celal.
My pleasure.
Very nice.
This is a good interview for us.